And welcome back. Well, people with fair skin and freckles aren't the only ones susceptible to skin cancer.
That's right. It's a disease that really knows no gender and doesn't discriminate based on age. In fact, 1 in 5 Americans would develop some form of skin cancer during their lifetime. And joining us now with more about it and a special screening event is Dr. Giacomo Maggiolino with Dermatology Associates and Forefront Dermatology. Great to see you.
Good to see you again.
Thank you for having me back.
Important stuff for people to know because, first of all, a lot of people should probably get a skin cancer screening. Who do you recommend has one?
Well, really everybody. Everyone is at risk for skin cancer. As you mentioned, 1 in 5 people will develop skin cancer during their lifetime. But people who have fair skin, freckling, light hair, they should definitely be screened. And really anybody who has a personal history of sun exposure or a family history of skin cancer are also at increased risk and should definitely be screened.
Well, you think about, especially someone who's fair skin, when you're younger, getting burned and things like that. So when you think about getting your screenings, what age should people start? Is there a time that matters?
Yes and no. I mean, melanoma is the most deadliest form of skin cancer. It is more likely in people over the age of 60, but it's also very common in young people. In fact, it's one of the most common cancers in people under the age of 30, especially in women. So if a young person, so if a young person does have a family history of skin cancer, they're at increased risk for skin cancer, and they should tell us about that family history during their screening.
Are women more at risk than men?
You know, skin cancer really has no gender, preference. Under the age of 45, women are a little bit higher risk for developing melanoma. Over the age of 45, men are a bit higher risk for it.
Okay. What about moles? Because I think that's the thing most of us think about when we think about what to look for on our own bodies as we're sort of checking ourselves. What's the link between moles and skin cancer?
So the moles that most of us are born with are not dangerous. It's the moles that develop later in life or that change over a lifetime, either in size, shape, or color. Those are more of an indicator of melanoma.
You have this event going on April 11th. What will you and your colleagues be looking at?
Sure. We'll be looking for any spot on the skin, birthmark or mole that looks different. Is it irregular? Is it jagged? Is the size greater than 6 millimeters? Is there color variation? I'm referring to the ABCs of melanoma, and actually it's the ABCDEs of melanoma. So A stands for asymmetry. If you cut a mole in half, it doesn't have a matching side. B stands for border irregularity. So the edges are irregular, they're jagged, they're notched. C stands for color variation, so more than one color, having different hues, such as from black to brown to red to white or even blue. D stands for diameter greater than 6 millimeters, which is the tip of a pencil eraser, and then E stands for evolving or expanding. Ultimately, anything that's new, changing, becomes symptomatic, becomes itchy or starts bleeding, those are some of the signs that we were looking for.
Those are a good kind of gauge to think about when you're looking, at some of those moles. What's something surprising about skin cancer and who's at risk?
You know, people of darker skin tone could also develop skin cancer. It's not as common as those people who are fair skinned, but it's still very possible. In fact, we don't want African Americans, Hispanics, American Indians, Pacific Islanders to assume that they're not at risk for skin cancer, because that assumption could actually lead to a later, more dangerous diagnosis of skin cancer. Ultimately, we want everyone to come in for a skin screening on April 11th.
Okay. In terms of the screening, I think people sometimes wonder, is it going to take a long time? Is it something on Saturday that I can do and take care of while I'm running other errands? Yeah,
these are baseline screenings. They only take a few minutes. A lot of people are able to come in before meeting up with friends for coffee or even in between their kids' sporting activities.
What happens if you find something at the screening?
If you find something, we can schedule an appointment, tell you more about what to expect based on what we find. We're ultimately here for your medical and your emotional needs.
It's wonderful. So this event is happening this Saturday, April 11th from 8:30 to 12:30. So for 4 hours, you'll be doing these screenings for people. It's you're with Dermatology Associates of Wisconsin. The skin cancer screening is free. Again, the time is 8:30 to 12:30. You can go to freeskinscreen.com to find a location that's close to you.
Is there anything you should wear that's easier for you guys?
We'll have gowns available, so if someone wants to get into a gown, they're welcome to do so. Otherwise, short sleeve shirt or shorts, weather permitting, of course.
Wonderful. Thanks, Doctor.
Thank you for having me.